All right, welcome back under the rug. We have returned for another episode. The great Christina Marlene Thompson, aka Chrissy Love, is present. She is here. Say present, Chrissy, like they do in school.
Present.
Chrissy is here. She is not in the Bahamas, but she is on the show as she is every week. She writes here, as I like to say in my Bahamian vernacular.
Come arrest me.
Where you is?
Government house in the Bahamas.
You by government house?
Yeah.
All right, send all the police to government house.
Calling all cars.
Yes, but like I was starting to explain to the people that are viewing via Facebook Live right now, watching us live on Facebook, it is not a typo, the title of the show. I did intentionally spell it HELLth because of the stories that I've heard from people about PMH and my own personal experiences with PMH, because I had I think it was 2 experiences with PMH, possibly. I think it was last year, either last year or year before. So I have personal experiences. So this is why I put what the HELLth, HELL, because the conditions are just unbelievable in some circumstances. And as you heard, for those on Facebook, you heard Chrissy asking me to show her the picture that I was sent. Again, a friend, like I said, they I think it was their first time experiencing Princess Margaret Hospital here in the Bahamas, because they're not from here, but they had to deal with an experience in PMH, and they were just taken aback, just so surprised at the conditions that not only the people that have to work in, but that the patients have to try and stay alive in. You know what I mean? So she sent me some pictures, and I sent it to Chrissy before we actually started the show. So I'm going to go ahead and flip my phone around and turn around. Let me see if I can let you guys see. This is actually, hold on, let me pull up the conversation. But this is actually the air-conditioned vent. And it's a vent in a room where people are, because clearly she was able to take the picture. So people are gathered in this room. And when you see the picture of this vent, you won't believe that they actually allow humans to be around this, because it just looks, I mean, I'll let you guys see it. Here, right here. Found it. Okay.
Getting paid.
Let me go ahead and try and put this up to the camera for you guys. Sorry for the people on SoundCloud. If you're on SoundCloud, hold on, let me try and line it up, go up. This here, guys, is an air-conditioned vent where the air comes through that you have to breathe while in that room. And if you can see all of the black gunk of mold and just nastiness covering this vent. The vent is almost completely covered in black.
Hold the picture up so we don't see her number.
So those, okay. Oh, sorry, you saw the number.
Yeah.
Partner.
No, you know how we go.
Yeah, but right there.
They may try to take her wig, play Mac.
There you go, right there, folks. That is a vent, an AC vent where air comes out that you have to breathe in the hospital, mind you. The place that's supposed to be the most sanitary place on the island. And Legal Eagle is saying, wait, what's that? That is an AC vent, Legal Eagle. Where the air condition comes out, that is an AC vent. And so we're here to discuss the conditions of PMH, the horrid conditions that it's in, why it's in these conditions, and how we can improve these conditions. Because let's be honest, most of us ain't like Chrissy, who got 2 passports and could hop and go. We actually have to live in this country with these horrible conditions. And so it's on us to at least do our best to try and fix these problems while we are here. So yes, that is an AC vent at PMH Hospital right now. And that's just one of the things. That's just one of the pictures that she sent me. But Chrissy, how did we get here? How did we get to this place where PMH is what it is?
Well, just to give you a bit of history, you know, one of the things that I like how you invite me into the show, because having lived in the Bahamas since 1971, I remember a lot of stuff. Also growing up in a political family. Lyndon Oscar Pindling, in the 60s, when the majority came to power, told the Bahamian people that he was going to give us a new Supreme Court building, a new prison, and a new hospital. By the 70s, Princess Margaret Hospital had outgrown its usefulness for the Bahamian people. We have a history of adding on and adding on and adding on without fixing the challenges. Right now, people don't like to talk about it, and it's a big secret among hospital executives. There's a huge water and electrical and air conditioning problem in the hospital that precludes a lot of the sanitary features that ought to be happening. The Princess Margaret Hospital outgrew its usefulness in the 70s. We always needed a new hospital, but like true Bahamians, we just piece up and piece on. We built the critical care block that was supposed to have more beds. And of course, Chrissy, in his infinite wisdom, decided to make the hospital have more offices than it had beds.
That's what I don't understand. Because I said this new wing and it got a bunch of offices. What was the purpose of that?
It's called stupid. It's called stupid. And so you still have the challenges. PMH has been inadequate for a long time. I remember spending my youth at PMH, whether it's in the operating room theaters. At the time, I think we had 6. Whether it's in accident and emergency. Again, if you've been there, you know it's outgrown its usefulness from that time. PMH also has a cleanliness issue. You have a bunch of janitors on staff, but the hospitals stay dirty. If you look at some of the hospital bathrooms, you could get all kinds of diseases just from using the toilet. So we've here to this point from years of neglect, years of not holding people accountable to do their jobs. Because I don't understand, like I said as a joke at the top of the show, you have the same woman who is the reason why Frank Smith is in court, but she still got her $1.8 million contract to clean the hospital, but the hospital still is dirty. It is just a cavalcade of issues that we have not been strong enough to address. We don't want to clean up the mess that is PMH. And until we have an honest conversation, now I'm going to give Dwayne Sands a piece of credit because he at least trying to fix some things. But then again, you have Dwayne Sands, who's a part of the Physicians Alliance, who've been benefiting from the hospital.
Yeah, Dwayne Sands was here. He came into our living room one day, and I was asking him about the healthcare system. And he was listing off all of the problems what were wrong, people that were working there, and he had no idea what their actual job was. Not only did he not have an idea what their job was, they didn't have an idea what their job was, but they on the payroll, they getting paid. So it's a whole bunch of issues that we have at PMH, but he never said exactly how he was going to go about dealing with these issues. Now, he was able to identify a lot of the issues, but identifying the issues is one thing. What you're going to do to fix them is another thing.
Yep, he's the Minister of Health now. So you're it.
Exactly. It's up to you.
Yep. Dwayne Sands also says he wasn't aware of the dead bodies on ice in Cat Island. Our health care
what?
System,
wait. What? Hold on now. You can't just run over that. The dead bodies on ice in Cat Island?
Yeah, but the people died in Cat Island, and then Family Islands don't have no morgue, so they on ice, stay in the bathtub with ice on top of it.
Man, stop talking fool, man.
Shit we doing in the Bahamas.
You serious?
He ain't know about that. Yeah, the thing is the healthcare system. First of all, is not healthcare; it's disease management. Because if everybody was doing well, the hospital would be out of business, except for babies giving birth and keeping people healthy and well. But the thing is, we know we've always had a bed shortage in PMH. There's always been a challenge with keeping the hospital clean. There's always been a challenge. I remember one time I had a cousin who was a burn victim. I had to purchase the bandages in Florida and bring them home for him because PMH didn't have them. And these aren't new stories. Our healthcare system has always been poorly managed. I remember my mother, when she was a part of the healthcare management team for accident and emergency, scratching out her hair to the point of screaming when she was so frustrated with her job. So it's never deemed to fix it because I believe someone's benefiting from the chaos. Who's benefiting?
But who? Like that's my question. Like usually when you're trying to figure out something that's not on the surface, you have to look beneath to see. You like you say, follow the money, right? You follow the money. Who's like I can't. I don't know. Maybe I don't know enough about our healthcare system, but I can't see. Do you have an idea who may be the people that are benefiting financially off of this chaos that is that now exists?
Well, first of all, PMH is a bastion of waste and mismanagement. It's been that way. And I'm not dissing any of the hospital administrators. I know you all, love you all a lot. But you've inherited a system that was flawed from the 60s and 70s. After we kicked out all the British people, we decided to run it ourselves. We started running it into a ground. We don't have checks and balances. And someone benefits from this because the more I waste the bandages and medication, the more I got to buy. Who are the people benefiting from, who are the companies benefiting from the wastage and mismanagement? The more I keep people sick and unwell, the more I run out of medication, the more I keep those beds full. I don't want to sound like a conspiracy theorist, but with all the expertise we have, I am amazed at PMH. Again, considered one of the better facilities in the region. I don't know how,
Yeah, you just said that before she left
Yeah,
too.
yeah, they say it is. But I just don't understand how you could be like, for example, my friend was pregnant. She had to spend the night outside on the gurney in the hospital hall until they found her bed to give birth on. You have baby women giving birth on paper and thing because
What?
bed. Yeah, it's sad. PMH is a sad
Yes.
clusterfuck of epic proportions.
And on the bad note, I got I have a source on the inside that said the reason why they don't have a lot of beds too is because people don't pick up family members. You have people. There's actually somebody that lives at the hospital,
Oh yeah,
at the residence as a resident. He lives at the hospital. You have people there that are occupying beds that family just left them, never came back for them, and they don't have nowhere else to put them. So they just taking up this space on these beds.
yeah.
And
People leave their children. I know a very influential person. That's why when she's come on social media talking shit, I was reminded, you forget you leave your baby in the hospital. Like, sit down. So you have many people leave their children, their relatives, and they just neglect them.
And they told me also, say, you didn't get bad for patients. You got doctors in there. At times they can't get drinking water. No drinking water for the doctors. And the doctors in these rooms with these terrible vents with all this mold and all of this stuff. It's like we don't care. We treat these people like animals. I don't know how nurses, and I want to big up nurses and all the workers in the hospital, because I really don't know how you continue to function in that environment, not only because it's so morbid, because you basically dealing with people at their worst when it comes to health. You know, they either sick bad or dying. You have to see people like that, but then you have to see all of that in these horrid conditions where your health is at risk. I don't know how these people continue to do it and go to work every day.
Well, kudos to the nurses who are doing their job. Now, let me just say there are some nurses who are lackluster and they were.
I agree. I completely agree. Not all agree.
Nurses doing the job and the things that they're exposed to. I remember one time my mother, because PMH didn't have the proper protocols, my mother was exposed to this virus, and my sister and I got very sick at one time. What? It led to my mother mopping off her shoes with bleach before she came in the house because you know taking home. Yep. So the workers are putting themselves at risk as well. But until we have a serious conversation on the Princess Margaret Hospital and what needs to be fixed, as opposed to adding on bits and pieces, we're never going to fix it. See, that's what we do in the Bahamas. We do what my grandmother calls clean, shine, and dirty capers. We always put new Band-Aid on old necrotic blood and urine and feces.
Yes, it's like I say all the time. Yeah, like I say all the time, we want to make sure the car clean. We clean in the car, but the engine ain't running.
Exactly.
The car don't run properly, but we got to make sure it clean. Make sure shine them rims up. Spray that thing on the tire, make them nice and shiny. They ain't got to know the car ain't running once it look a little good. But the thing is, what it sound like with PMH is we ain't even trying to make it look good. You understand? You see that vent? I mean, that is ridiculous.
You need to go in female surgical. When I was visiting my aunt in female surgical, again, all it takes is a mini vac to vacuum out the vents. It's not like this is big cleaning. It's regular cleaning and it's maintenance. And you know, the Bahamas is a country that is not good with maintenance.
No, we don't maintain very well.
We're very dirty in how we take care of stuff. And it's very frustrating. I remember when I used to visit my aunt, it was disgusting. But I know you have to visit your family because it's the right thing to do. But it takes a lot out of you. If you go to a bathroom in the hospital and pick up the first lid on the toilet, if you see the things that are underneath that lid in some of those bathrooms, and when you tell them this bathroom is filthy, they just like brush you off. Okay. Yeah,
because they're used to it like that. That's something they're used to. You know what I mean? You know, where you in something for so long, you become used to it. You conditioned to like, okay, that's just another day. You know what I mean? It's nothing to do. Yeah, and that's probably, I think that's the point that they're at right now. They just like, oh, well, you know, the bathroom always dirty. Every time I come it like that. You know what I mean? So that's where we at right now. Unfortunately, they've just become numb to these issues.
That's sad. One place you expect cleanliness.
Yes.
Where people are convalescing and hoping to get well. One would think that you would clean, like you said, the vent. You're breathing in that air.
And this is my point.
Soot and mess.
Yeah, and that's my point. Is like it's like the simplest issue. Like Chrissy, we look at these issues, right? And this seems like the most basic, simple maintenance items. regularly cleaning an AC vent. You know what I mean? Simple things you
why
can't
should I care?
do.
Why should I care? Because what happens the 28th of every month?
I get paid.
Okay, then.
That money there.
Okay, money in the treasury in your account. So why should I give a shit?
Lucy, the bathroom are cleaner at fish fry.
I saw that. Lou need to look at it.
And you know how them bathroom, the fish fry look.
We just have to do better. We have to become a do better nation. And you know, they always say you could see a nation. You can tell a lot about a nation the way it treats its elderly, its dead people, and its pets.
Oh, pets? What about the young children?
Yeah, young children too. But we put them in the tub covered with ice, so that surprises me.
Yeah, I had no idea that was even taking place. That is ridiculous.
That been taking place in the family island.
What we done? What wrong with us?
You know, I believe, and people laugh at me and say, "Oh, Chrissy, love, you're just such a bitch." I believe, well, I can be. I believe that the nerve gas that they dumped off of the Bahamas in the 70s has affected generations of us. That's my theory, and I'm sticking to it. Like something wrong with our thinking.
I think where we went wrong is we've conditioned our people to just take abuse. You know what I mean? To just listen, don't challenge authority, sit back and take it. Ain't nothing you could do about it. You meet it here, you can leave it here. All of this attitude is woven into our culture, and we just sit back and be like, well, hey, listen, I ain't getting it. Ain't nothing I could do.
Look at the many people who died at PMH when we had that big scare with the virus in the dialysis unit. PMH has killed more people than the, let me stop. I was going to say it in one order.
Well, mothers. Oh,
Lord. That was me.
Yeah. But like, and it ain't like, and it's not bashing PMH, because I made a post and I asked for people's stories, and I must be honest, I did get a positive one, and someone said that PMH did save their life. You know, they had an issue, they went in and PMH saved their life.
Praise God.
Of course, you also had other people that were traumatized by, you know, mishaps and just negligence on the part of, you know, the people at PMH. So it's mixed. You know, some people have some good stories, some good experiences, but mostly what I hear is often negative and bad experiences. And like I said, I have my own experience with PMH, and my issue is with, okay.
Oh, Lord. Okay.
The Keitra had to go into the hospital a couple of times on a couple of occasions for surgery. And it was a minimum of a 10-hour wait each time you have to go. A minimum of 10 hours if you're lucky. Because I've heard other people say they've been there for more than 24 hours. Some people have been there for, like, it's ridiculous the time you have to wait to get served. Gail, before she left, said she was dying and she had to wait hours to go in the next waiting room. You know what I mean? So a lot of complaints about PMH relates to the wait times, the ridiculously long wait times because of the understaffing. First of all, they are understaffed. They don't have enough beds to place people. So when you have so many people coming in and you have literally nowhere to put them, to where you have them on the drip, sitting in the waiting room with the drip in their arm, you know what I mean? And that was real. I had to sit next. She had a drip in her arm, sitting in the waiting room. You know what I mean? I mean, which is, good to a degree, because you're trying to manage with what you do have, and at least you get given the drip and not just waiting for the bed because they might die. But it's still crazy that we don't have enough beds or enough accommodations for these people in 2018, where we see us spending money willy-nilly all over the place, buying out Bank of the Bahamas twice to the tune of almost $200 million.
You see, it's for $20,000 a day.
This is what I'm saying, but we can't fix the AC, and we can't improve the conditions, the PMH, or get more beds.
They don't care, because there's a government minister of health a couple of years ago, when he was having a health crisis. He told the ambulance to take him to Princess Margaret. They had to remind him, Minister, you're the Minister of Health. If you don't go to PMH, how would that look? You see our politicians who are in charge at healthcare, they just go to Cleveland Clinic.
Exactly. They don't even stay in the Bahamas.
Clinic. And they don't go away, so they don't give a shit.
No, it's illegally to say. I think I would commit suicide if I ever had to go to PMH. I only born there in the 70s, but thank God never had to go back, other than visit family rarely. So people don't even want, and I was like that too. I'd never wanted to. From all the horror stories I heard about PMH, I had no desire to go. But like I say, last year. I think last year or a year before, I had to, on 2 different occasions, extended periods with PMH, and plus with the birth of Kaylee as well, 5 years, well, almost 6 years ago now. But I've had my experiences with PMH also, and I've seen the conditions, like you said, in the bathrooms, the vents, the mold, these horrible conditions, and also, like you said, the bad apples when it comes to the staff, the people, because you do have some bad apples, you do have some bad attitude nurses, some incompetent nurses, some negligent nurses. So we do have some good ones, but we also have bad ones. As with any industry or any sector, you know, you have good and bad. Doctors too, yes.
Doing mass. You know, I know I've gone to PMH twice in my lifetime. Once when I was 11, once when I was 24. And I will admit, I can't say I had a bad experience, but then again, I believe it's only because my mother was in the executive of the hospital. So they made sure to check and make sure they wasn't doing shit. But I've heard horror stories from many people. And I remember going to the hospital with a family member of mine who was in the executive healthcare team at the hospital. And we were in the hospital for 16 hours because the MRI and the scan wasn't working. So she had to be transported all over the place after a car accident. We just have to do better. And see, Bahamas get mad at you when you say these things, but we have to do better. PMH dump, it needs to be fixed. It's been a dump from the 70s. Fix it.
And you know what happens is we tend to, a lot of people attach themselves to their position, so they feel like if you are talking about these things or exposing these things, they take it on as like a personal attack, like, oh, you attacking me. You know, right? And that's, they have to realize is we doing this for, we trying to help you benefit because you are not in good conditions, clearly. So I don't know why you would jump up to defend something like that, but we have to take care of the nurses, I think, first of all, because they are the front lines and they are dealing with people. Well, everyone. But I mean, like, I think it was, isn't it, aren't like nurses going now being recruited by other countries? Like they recruiting from the Bahamas because they see the conditions our nurses work in. And they like, listen, if y'all could work there, y'all need to come over here. I think they go into the U.S., a lot of nurses, eh?
And that's a challenge. A lot of Bahamians, as a matter of fact, the Minister of Health was in the news the other day talking about so many Bahamian nurses leaving the Bahamas and going to America or going to other places for opportunities because of the challenges. I remember my mother being very frustrated as a nursing officer and as a nurse. You know, you in the operating room theater and you don't have the things you need. And, you know, but PMH is the public hospital, so it has its challenges. But the thing is, our Treasury gives lots of money to the PMH and to other arms of the ministry. The clinics have their issues. Where are the supplies going? Why can't we manage the hospital sensibly? Because, no offense, we have a lot of people. Hubert Ingram started the Public Hospitals Authority, which was supposed to bring some order to the governing of the clinics and hospitals. It's done a bit of a good job, but it still has issues. I remember I was supposed to get a malaria shot at the Blue Hill Road Clinic. They didn't have the malaria tablets. They didn't have any of them. Why are we running out of things?
That's another thing, like running out of items and items that you should have on hand. Like that's another issue. It's just poor management all around.
Exactly.
And I don't blame the persons on the front line. You know what I mean? It's all from the top because they manage the situation and they don't see anything wrong because clearly they aren't changing anything. This is an important call. Carla Jones says everyone talking bad about the hospital PMH, but it's the first place they run for help when they have no money or no insurance. Well, to be honest, Carla, I mean, if you have an option between death and PMH, I think you can choose PMH. I mean, a lot of people don't have no choice, but we can get to that, Carla. We're gonna address how we can improve public health care because you know a lot of people are struggling. A lot of people don't have money, especially for the cost of health care. It's ridiculous. You don't want to go to doctors.
The cost of health insurance.
I would not consider myself to be a poor person, and I can't afford doctors. You understand? Yeah. So when it's the only option you have. I mean, you have no choice. You want to live, so you go and you're going to sit there and you're going to wait. But we're going to address that a little later. You know what I mean? But like I was saying, I don't, oh Lord, legal say she would choose that. Yeah, right. You ain't going to choose that.
But the thing is, we must remember now, even though PMH has its challenges, the other hospitals on the island, Doctors Hospital is far from perfect as well. I stayed at Doctors Hospital before. I remember I have a particular medication. I had a bad ear infection at the time when I stayed at Doctors Hospital. The thing is, the same professionals who are doctors are at PMH. So it's the system that needs a revamping. And for the record, Carla must remember that the PMH is just that, a public hospital.
Yeah, and Lisa Tamara Edgecombe says, I'm a nurse living in the U.S. and would love to come home. She said live, but she means love. Would love to come home and work, but I can't see working under the state it is in. And that is very important, because I see Lou is saying it should not be about the money. Well, here's why it's about the money, right, Lou? Here's why it's about the money. Because money is very important. Let's be honest, we are all human beings. And money is important. If you don't have money, you can't sustain yourself properly. And that leads to other issues and you not being able to perform at your highest. You understand? Right. Money is important. And people need to be paid what they deserve, especially for the job that they are doing. They need to be compensated adequately. So money is an important factor. And I don't know, Chrissy, you have an idea what around what nurses get paid, like on an average?
I don't know now, but I remember when I came home from college and I got my first paycheck, my mother told me that she had never made that kind of money. Mind you, my mother was a person who was a nursing officer too. She was running clinic administration and A&E. She was a seasoned operating room nurse, and yet she wasn't making $25,000 a year. I have a family member who's an administrator. She makes less than 40 grand a year. Now, of course, when you work for the government, though, you go in any bank and get all kind of loan. But money may not be the issue with regard to health care, but you have to compensate individuals. I have nurse friends who've been bitten by patients, who've been spit in the face. But, nursing is a hazardous profession. So people should get paid what they're worth. I don't know what the starting salary is now, but I remember my mother and her friends always bitching about the pay for nurses.
Well, look at this comment. Michelle Moore says, just tuning in, but doctors not there either. And that's what you were saying. They have issues as well. And she says, I'm $129,000 in debt after a botched surgery at doctor's hospital. I'm still trying to have that surgery corrected.
Wow.
She is $129,000 in debt for a botched surgery. Something that was not even completed correctly.
Yep, that happens a lot. There's another friend of mine who had a botched surgery to do with her breasts, and the doctor has a judgment against him. He has yet to pay it. Because, again, just like how the judiciary is a fraternity, the doctors are a fraternity as well, so they don't talk on one another. But then you have the same doctors who are using our public facilities and making themselves wealthy. And people just let it go on and on. We see nothing with it.
Yes, but back to the money issue, right? Like I said, I don't know what nurses get paid, but I imagine it's not very much. But it'll be amazing if you could see the difference when someone is being paid what they feel they deserve when they're making a good amount of money. Now, not saying that that's going to just automatically correct it. Not saying, hey, you pay them more and it's going to be all fixed. No, but I'm sure you will attract better, higher quality persons to take these jobs in the first place, because a lot of people are not going to take it because they know their value. They know they're worth more than that. They know they cannot live comfortable lives on that money. So if you pay them a high amount of money or a decent amount of money, they will be more prone to take on these difficult tasks because it then makes it worth it financially. You know what I mean? So, to attract the best, you have to pay them adequately. That's important when it comes to getting talent. This is why you see so many people make it like companies would shell out monies for certain people because they recognize their talent and they want to have the best. So if we would like the best in the medical field, we have to pay them accordingly.
But Greg, we don't pay them. There are nurses who haven't been paid in 4 years. You may have remembered the Minister of Health, the current Minister of Health, claiming his shock and horror. Mind you, the nurse has been saying this for years. They haven't been gotten paid. Can you imagine not to get your pay for 3 years?
I can't imagine not getting paid for 3 hours. You're talking 3 hours. I can't imagine. You're talking about 3 years. You got to be kidding me. But that is ridiculous. Why? And like I say, when it hurts, Chrissy, is when you see the government spending money like drunken sailor, like on foolishness. What happened to those boats we got for the Defense Force where we spent almost $300 million on?
You mean the boats we can't drive, and my cousin knocked two into the wall?
This is what I'm saying. $270 something million. Gone.
But yeah, they still coming to Coral Harbor.
This is what I'm saying. Exactly. And you could have it. It was within 1 week, right?
We are joking. Yes.
2 landings within 1 week, I think it was.
They come to hail them at Coral Harbor. Hey.
My goodness. Lou says, I meant any human being deserves the basics of health and care. I agree that the nurses should be paid adequately, and that should not be a problem. Yes, everyone deserves, but here's the thing. And Chrissy, I do have an idea that I feel would help. Say again?
I love ideas.
Oh, okay, yeah. I have an idea that I feel would help at least to generate more funds. I think it could work in 2 ways. I think it can help when it comes to nutrition, because I'm all about prevention. I don't like to be reactive and wait till something happens to try and fix it. Let's look at some prevention. Yeah, that's the Bahamian way is correct. But I don't like that way. So I think it can help when it comes to prevention, and it can also work on the other end in terms of helping the people that are already at that point. And I think we should have a fast food tax, right?
Yep. Well, so we have the sin tax, fast food, alcohol, cigarettes.
Well, I don't like to call it sin tax, because then you bring in religion and all that foolishness into it. You know what I mean? And then you calling these things sins. I don't like the word sin tax. I know some people refer to that in different countries. Say again?
We're a Christian nation, so we got to put sin somewhere.
Stop lying, yeah? But Christian nation. Stop talking fool. But a fast food tax, whereas you put a little percentage, little 5% or whatever, whenever you go to your Wendy's, your McDonald's, your Bamboo, your Burger King, whoever. Basically, where Bahamians eat on a daily basis now, because ain't nobody cooking. Nobody cooking, right? And I see Catherine saying no. Let me flesh it out. Hear my idea out, right? Listen. So you throw on a small percentage, because I seen people absorb VAT and people still spending like the same way. You know what I mean? And that's why the government was so surprised at how much money they making from VAT, because people's spending habits basically didn't change. Still was spending, and that's a whole 7.5%. So here's what you do. When you slap on the little piece of percentage, whatever you decide it is, that money exclusively goes to health care. Strictly for healthcare, whether they need machines, they need to pay salaries, whatever the healthcare industry needs, all of the fast food tax money is allotted strictly for healthcare, because clearly we don't have healthy diets, and it's causing people to have conditions and causing them have to go to the hospital for so many things. So this money can go to help towards at least, funding that, and it may help people to cut back a little bit on the amount of fast food that they consume. And at the same time, you can also lessen the taxes on healthy food. So you want to help to push people towards the healthier options by reducing taxes on those things. You understand? So you move those taxes off of the healthy foods, and you put a little tax on the fast food or the unhealthy foods, and let that go strictly to healthcare. So hopefully people would, start to cut back a little bit on their fast food consumption, which helps. And if they don't, at least we have some money for when they do have to go to the hospital. What do you think of that idea?
No, that is a good idea. And, the thing is, it's been proposed a lot, but no one has ever fleshed it out to that point, and we haven't seen it enacted. Because preventive care is something that we talk a lot about, but we don't do anything about it. We just talk about it and talk about it. But we all know that our rates of non-preventive communicable diseases is astronomical. But they were going to do something about it, but we don't. So if any way we can alleviate some of that and help with education of our people, I'm sure that'll be, like, for example, when I do health shows, people tell me, oh, I didn't know that did that to me. So a lot of times we just don't know. And
yes.
No, you make poor choices.
I agree.
So
now, of course,
and a change of heart, I think that's a good idea.
Yeah, that's my, and I know people say, oh no, people don't need more taxes. Even if you, but then again, we would have to, in order for that to work, we would have to fix the corruption that exists now, because again, you can earmark this money for one thing. That don't necessarily mean that that's where it can go. And that don't necessarily mean that they're going to spend it responsibly and on the right things, because clearly we have shown that we don't have the ability to be responsible with our funds. We don't have fiscal responsibility in this country. So those things have to be addressed first. But that's just an idea. If we can get that together when it comes to being able to spend it properly, because we do spend a lot of money in education, and look at the schools. Look at
the grades.
Look at the teachers, right? Look at the grades. Look at the teachers' salaries. Look at that. So we throw money at things, but we don't spend it properly. So I don't want to just
like to, because the thing is, we know why we don't do it, because it's going to take a total revamping of the system. It's going to take a whole digging up and rooting up of what isn't working, and we basically don't want to do the hard work. We just want to put band-aids over dog shit.
Yeah, you're right. And Jasmine says, or Yasmine or Jasmine, not sure how you pronounce it, but he says, who owned the fast food chains in the 242 again? And then he put that little emoji on the side. Well, hey, it's a good point. You know what I mean? And that's, again, this is where corruption gets in the way.
They do get sick.
Yeah, and this is where corruption gets in the way of so many different things. Lisa says, so is the system still set up that no matter what you do on your job, you don't get fired when working for government? Because if people have no worry about being fired, they tend to not do their job. This could play a large part with PMH. What do you think about that, Chrissy?
Well, it's hard to lose a government job. Lisa's right. But the thing is, it's the lax attitude of our people. You would want to put in a good day's work. You would want to do your job. Like, what irks me now?
What's that?
Just gone down all across the board. Like, I remember being at PMH a couple of months ago and seeing this nurse totally unkempt, her nail polish chipping off of her hands, red nail polish, I might add. I remember there was a time when nurses didn't even wear nail polish, or if they did, it was something pearl or neutral. If you don't take pride in yourself, it's hard to take pride in your job. If you're coming to work unkempt and you don't care, maggots in your weave, people got to just change how they look at life and make a conscious effort to do a great job. The thing is, when you're sick, and that's what I remember a nurse at PMH, when she was giving me attitude, I said, when people are unwell, they can't take your attitude. You're already in a situation where people are in pain. So you give attitude isn't going to help the situation. Just give me fucking Tylenol before I choke you, bitch.
But that is a good point by Lisa. And here's the thing about that too. I think what we do is we seem to value quantity over quality. So we understand that we are short, right, with nurses. So we like, listen, anybody, y'all just come, run, take this little course, and then come. We can slide you all in and give you all a job. And people like, well, anyhow, I just need a job. I just need to pay my bills, child. They
warm in the Bahamas.
Yeah, let me go take this job because this is a paycheck and that's all I need. When you have those kinds of people with that mentality, of course, you're going to get lackluster service. You're going to get the negligence because they really don't want to be there. It's just a paycheck. You understand? So we need to put emphasis more on the quality of persons as opposed to the quantity. Instead of saying, listen, we need nurses. Come one, come all. We just need to fill these positions. We need nurses. How about, like I said, you have to make the position desirable. So you have to have the pay to where it is attractive, and you have to have the conditions to where people would feel comfortable in these conditions. You have to make the environment conducive to people wanting to join that particular field. And if you do that, you will have a higher quality of nurses, and you would have less of that issue where people ain't doing their job and they just have a job waiting for the paycheck. You have less of that.
Yeah, and we have to put the emphasis back in training. Unfortunately, in our country, when money is tight, the first thing to go is the training and upliftment of the people. Many of our nurses, we have a nursing school, yes, we have programs, but, the training is crucial, and a lot of people miss that. That's why you have nurses and doctors themselves. If you aren't kept abreast of the changes in your field, you're going to miss the boat, and a lot of people don't realize the importance of keeping up to date with what's new and what's trending. A lot of people feel that once they've arrived, they don't have to learn anything else, and that's a sad thing.
Yes,
but
that is true.
People have to start thinking differently. Until we think differently, very little is going to change, and that's my lament about my country. Until we think differently,
and that's exactly what That's exactly what Yasmia, like I said, is saying. Real talk. In order for the Bahamas to change, Bahamians have to change everything wrong with the country. Starts off with the mindset of the people living here.
Yeah.
That's the problem. Our mindset. We have to change our mindset that we have, and people ain't want to do that. That's difficult. That's a hard thing for people to do, you know, Chrissy.
Yeah.
Something that you've been conditioned to believe and look at a certain way your entire life, to just do a 180 and change that's difficult for a lot of people.
But if it ain't working, I could see you holding on to things that are working. But if it isn't working for you, then why are you so linked and tied to that? I just don't understand. Every year we whinge and whine and carp about the condition of PMH. We hear about people. I always tell the story when the second prime minister's family member died waiting in A&E. I thought that things would change.
Wow.
Yeah, but we don't want to change the systems. We believe that this how it is, this how it always been, and this how it gonna always be. And that ain't working for us.
Not at all. But Chrissy, we love things just because that's how it's always been. It don't have to make sense. We don't care. We can convince ourselves that somehow just working. That's why we still beating our children and we fighting for that. You see, they say they're taking it out of schools. People outraged.
We can stop being school.
No, but see, people holding on to that. It ain't working, but people still holding on to it. A lot of things people hold on to that don't work just because they don't know nothing else and they're afraid of that change. They don't know
smart people. We are smart people. We know what has to be done. Like if I'm the janitress and I'm getting paid, okay, janitress really don't make no money, but still, use a janitress, and that's the pay scale you sign up for. I got to tell you to lift up the first lid on the toilet and clean the bottom. Like, I really got to tell you.
No, man.
I got to take a toothbrush and clean out the cracks in the tile with bleach. I have to tell you the mold don't belong there. Like with that air conditioning vent. I have to really tell you to dust that daily and sometime unscrew it out of the window, out of the wall, out of the ceiling, and wash it. Like, I really have to tell you that? Like, do you have
that's when that's when you don't take pride in your job and you genuinely don't want to be there. Well, you genuinely don't want to be there. But that's the thing. No, boy, I need this little piece of job. Chrissy, just paying my bills. What you mean go home? I know when I show up to work, they can give me this little thing and I could be able to at least pay my bills. That's the reality of the situation.
Sorry, Greg. No,
I just saying that's the reality of the situation. That's how people look at things.
I just don't understand the comfort level and holding on to what isn't working. Again, maybe because I'm a little older than all of you guys. The dumpy PMH question has been shut your teeth, Greg. The dumpy question has been spoken about ever since I can remember myself. Again, we outgrew Princess Margaret Hospital a long time, and even with the new critical care block, we botched that up. So we decide what do we want for healthcare.
And when I saw that new section being built, I was like, finally, we trying to address this issue with PMH. We get more space now. We should have more beds.
Yeah,
better.
They put offices. You can thank Perry Christie with his brilliant self. Perry Christie and Marcus Bethel and Perry Gomez. Yeah, you can thank them for that brilliant decision. We don't need beds. Let's make offices so people can feel impotent.
My goodness.
Be serious.
But this is another idea that I had, right? Because there's an issue at PMH that is the overcrowding, right?
Yeah.
So many people just go into PMH because, listen, that's the only hospital you could go to. Yeah. You understand? So you got to go there.
But it's the easier to go to.
Well, yeah. Well, okay. How about this, right? Why don't we? Now we already have a lot of clinics around the island, right? Now, I don't know. Are you aware of the reason as to why people have to go to PMH as opposed to the clinic?
Well, another thing, we need to train our people, because you have people going to the A&E with a staple in their hand. We have to remind our people that accident and emergency, it's just that, accident or an emergency. It is not for you to go there if you have a sniffle or a cold. That's why the government has its satellite clinics all throughout the islands. Of course, a lot of the clinics don't have what you need. In the family islands, our clinics never have the things they need. So people are just, I guess, feeling more comfortable in going to PMH one time. You have people in the family islands who would rather fly here and go to PMH, fly to New Providence, because they don't trust the care in our clinics. And so it takes a changing of the mindset of the people, but it also takes the public hospitals authority to properly staff the clinics so people would have more faith. I remember going to Flamingo Gardens for, I think I had something I had at Flamingo Gardens. And I remember getting there very early in the morning, and it took me about 3 hours to be seen for something as I had wheezing, I think, because I was self-medicating with a cold and it got worse. But, you know, clinics are not equipped, and people have lost faith in the clinics. You have to wait on them long lines. If you go to any of these clinics early in the morning, it is a sight to behold.
Yeah. Oh, so it's just like the hospital, and you got these long waits at the clinic too?
You have people in the hospital who you make an appointment to get your eyes checked when you reach the hospital. Oh, the doctor ain't here. You have people who wait in the clinic to get their dental appointment. When you reach there, oh, we ain't call you and tell you, oh, we ain't have no dentist today. You see, we need order. We need order. Look at Greg.
Who's in charge? Well, I was told that.
Who put a fool?
I was told the PHA is in charge of these things.
We have people who are in charge. It's just, again, the system. The system. The thing is, you ought to know what facilities. I have a relative who used to work in the dental clinic, and again, he used to lament the stress that he used to go through in trying to provide simple things to our people. Who's in charge of ordering the stuff? Who's in charge of supplies? Who's in charge of inventory?
This is my question. Who's in charge of these things? Why are we not putting heat on the specific individual or individuals who is responsible for these things? Like when it comes to the maintenance of the air condition, maintenance of the vents, when it comes to the supplies, providing all of the pills and all of that stuff that they should have, when it comes to the equipment, like who's responsible for this? This is the person we should be putting heat on, because they just sitting back chilling with their feet up on the desk and collecting their paycheck, and ain't nobody checking for them. We always attack the minister or the people that are, publicly seen.
It has nothing to do with it. It's the administrators. I know a couple of, but like Lisa said, you know that there's very little. You have to basically go inside your supervisor's office and shit on top of his head to get fired from the government. So people know they're secure, so they're not going to do anything. But the thing is, it's oh Lord, you saw that comment just now? It's going to take a total revamping, because the administrators that are in the hospital, again, I know a few of them, they've inherited a problem that's been going on for decades. PMH has been dumpy since 1974. It ain't nothing new. And so you build upon a system that's flawed, you're not going to get a system that works.
Yes, and that comment was Danette. Say yes, was thinking the same thing. Yes, was thinking the same thing. They really needed to knock that entire building and rebuild a new one. It is nasty and disgusting, and also some of the people working there, attitude stinks. Yes, Chrissy, no one can take charge in that place. Wow. That is very, very sad.
That is sad.
That's very, very sad.
Because the talented and smart. We have Bahamas, again, the Minister of Health. The Minister of Health is one of a handful of cardiovascular surgeons who are, in demand all over the world. So if we have that talent there, we had one of the first orthopedic geniuses in this country who pushed my mummy in the operating room theater when he was high. Anyway, we've had I always have to throw that part in. They hate when I say that. We've had so many bands in these specialties who are just amazing surgeons. We've had brilliance pass through PMH. But what we do, we frustrate people, and we don't want to fix it. See, you can put Band-Aids on top of dog shit for only so long. You have to clean the dog shit up, disinfect it, and then fix it. But we don't want to fix it. If you go on the bathrooms at PMH, look, the toilet is cemented into the ground. Look at the bottom of the toilet and see all the junk. Just a simple cleaning. And when you go in these bathrooms, like I go in there and I'd be like, really though?
Wow. Jeez. Rose says, when company saves money, don't get bonuses? What? Okay, I don't know if I understand. Expense. Kendora says, me personally, I would never choose to go to PMH for major healthcare concerns. I prefer to go to the U.S. and deal with the bill. Wow. People would put themselves in debt just not to deal with it. But like I was saying, I asked that question about the clinics because my idea is, right, we already have these facilities throughout different, sectors of the island. You know, you have one out here in the east, you got something in the south, you got, you got them at different portions of the island. So why don't, right, for New Providence, yes. So why don't we equip these? We could take some of the same money we keep flushing down the toilet, right? And renovate these clinics and equip them with the necessary equipment to make it like mini hospitals. Like whatever you used to have to go to PMH for because you couldn't get it to the clinic, let's make sure the clinic could now provide those services so that everyone doesn't have to go and file the PMH and deal with that overcrowding. Let's spread it out. And it would be easier because now if I live in South Beach, I could go right there to the South Beach clinic. I ain't got to go all the way to the northern end of the island to try to get the PMH. Yeah. Let's equip these clinics with the necessary equipment so that they can become mini hospitals that people can go to and receive the necessary care right in their area. Right in the area. And you could solve that overcrowding issue to PMH.
We've tried that. Now, remember, the whole mini clinic situation, that's always been a plan of several governments. I know recently the mini hospital in Exuma that took 722 years to open, the mini clinic in Abaco. We have done mostly mini hospitals, in the Family Islands. I know that we attempted to do the whole mini hospital thing in, Elizabeth. When that clinic was built, a lot of the newer clinics, the plan was to make them like more of a mini hospital. But, plans is one thing, action is another.
Yes. Oh, sorry. Yeah, yes, you're right.
Who wants to trek from South Beach to go all the way up to PMH on Shirley Street?
That's what I'm saying. That's what I'm saying. It's like
are closed at night.
Oh, what time do clinics close?
I think the clinics close. Well, I mostly used to go to the Blue Hill Road when I think that closes like 4 or 5. A lot of the clinics are not open in the time of need. That's why A&E is so gunky and packed up. Now, luckily, we've had private alleviate the challenge with the walk-in and Insta care centers. A lot of private businesses have gone into that. But it's a lot of work to be done. It's a lot of those solutions you have are great, but the implementation of those solutions is a challenge in the country.
Yes, clearly we don't have the political will or desire. Dito says that's how it is in the States, Greg. They call them outpatient facilities where they can go. Where they can do a lot of the things, barring major surgeries. So that's like I always sit back and wonder why what. We have all of these clinics around the island. Why everybody got to file the PMH for issue? And a lot of these don't be major surgery issues. A lot of these things should be things that you can deal with at the clinic. You know what I mean? I see Crystal Turnquest is saying South Beach closes. She thinks at 10. At 10, she thinks it.
Oh, that's it. Okay, I've never been to South Beach. I usually go to Flamingo, Elizabeth, and Blue Hill.
Flamingo.
What they call the creche was where mothers used to go to get pre- and postnatal care. That's why they call it the creche on Blue Hill Road. But when I went to get my malaria medicine and my shot to go away when I was going to Africa, they ain't had the shot and they ain't had the medicine. Bird control. If it's one medicine we need to keep, it's bird control.
You ain't lying.
Keeping people from breeding.
Tito says he's been in a hospital where the bathroom looked like a 5-star hotel. Of course, that's in the United States. Not here in the Bahamas.
But we can't compare now. We can't compare ourselves to America. Like just the other day, I went to the dental clinic. I breezed in and out. And this is a public clinic. But then again, it's hard to compare America to our meager resources. Our resources are plentiful compared to other countries. But
I was about to say we have the resources.
Yeah, we have them, but we don't apply them properly.
Exactly.
Is everything so janky?
And Sydney says right here the reason why no leadership.
Well, we have administrators. We just recently changed the premier hospital administrator. About time he carried his ass with his teeth and said,
I didn't even know that.
Alcohol.
Jasmine or Yasmir. Hey, listen. So please tell me if I'm pronouncing your name right, because I keep saying Jasmine or Yasmir. I don't know how it's pronounced. But please let me know if it's Yasmir or Jasmir. But he says, as big as them rats was that be running around that dumpster in Lizzie Clinic yard, only Christ could convince me that rats ain't all through that clinic.
Now, come on, rats are everywhere. New Providence has a vector problem. You can't just single out Lizzie Clinic. The whole island has a vector problem.
Okay, that was right.
Two-legged,
Yasmir. Okay, that's what I thought.
four-legged.
Yeah, well, you're right about that. But that's what I thought. Yeah, he says it's Yasmir. But yes, those rats. Hey, listen, don't let the rats discourage you, man. Rats need healthcare too, you know what I mean? They gotta go and get their situation sorted out too, you know. You gotta share.
I'm gonna punch
You gotta share, Yasmir. You know what I mean? The rats need healthcare too, man. Everyone, healthcare is a right, not just for human beings, but for rats as well.
They need to go to the Humane Society. The rats want healthcare. Now remember, the rats have to do with, again, we suck at the collection of garbage. Remember, there was a big scandal with a lot of the clinics in the country remember the big clinic that dumped the biohazard material and all the needles and people's information was there? You remember?
Hold on, talk about this, man. I remember vaguely hearing about something like that, dumping needles or something.
All the biohazard material was out there in the open, all kind of needle and blood and people's name, just out there in the open. You see, again, we have to have systems that respect the biohazard, the way you clear biohazard debris. We just have the system is broken, and until we admit that the system is broken, we can be right here talking in circles. Mm-hmm. Okay. Go to PMH for your organ to take out your leg get amputated. We have to stop doing shit.
Yeah, I agree. But then, you know what? I think we need some homework. All us, not just me, right? Not just me and Chrissy. Let's have an assignment. People, let's find out.
Hold on, I'm awake.
No. That's why I put it out to all the people who watching too, because I'm sure all of us are frustrated with this current system we have, right? Let's find out, let's find out who is responsible specifically for these things when it comes to the maintenance of the hospitals. That means like cleaning, maintaining the air conditioned systems and the vents and mold control and these stuff. Let's find out who is specifically responsible for also providing
the hospital administrators. We have 4 hospital administrators. Mm-hmm. I'm not going to call their names, but if you go on the
why not, man? If that's public record, you can call their name.
Get touchy.
But that's public record. They sign up for the job.
We have Mary. We have the Rose woman name. We have one of my family members. I don't call her name. We have administrators who are in charge, assistant administrators and administrators. The one you see in the press all the time is Mary Walker. There's also Mr. Brown, who just left the Public Hospitals Authority. We have many people in the hierarchy at the PHA. Again, I give Hubert Ingram credit for establishing the PHA. I just wish he gave the PHA more powers to do something about things instead of just having meetings and eating chicken sandwiches.
Okay, but who have the powers then? If they don't necessarily have the powers to do these things, who does? Like who? I think, because I see Sydney saying Ministry of Health. That's too vague. You know what I mean? That's the whole ministry.
Doesn't know. It's the PHA. The PHA, the Public Hospital Authority, is the person. Hubert Ingram had this thing with authorities. They run all the public facilities. PMH, the RAND, the clinics. They are the mini hospitals in the Family Islands. PHA, it comes under that umbrella. There's someone I don't know, now that Brown is gone, I don't know who's in charge of the PHA anymore. I used to know these things, but I really don't give a shit. And then PMH falls under that, as well as the RAN, and there's a board. There's levels of, that's why they needed all them offices.
I see. Okay, makes sense now. That makes sense. But I think we have to really figure out who it is that's responsible and deal with them. Like, I'd love to talk to them. I need to get one of them.
She's not going to give you an interview. She might.
That's what I'm saying.
I've been trying to get an interview with Mary Walker for the longest. There was a time when Collie was there. I was trying to get an interview with her. But the last Minister of Health, fire her, and everything is political, Greg. That's why nothing works, because everything is political.
Right.
We hired based on who you related to, and if your dad husband was a former Minister of Health.
See, that's our problem, and we say we want to get rid of these problems, but then when it comes to election time, we go right there and fall in line and do the very same thing over and over and over and over again, which is put in power the very same people that have watched over these broken systems for decades and have done nothing to rectify these issues, yet we excited to go and mark our X next to their name because my Grammy was a PLP, my pa was a F&M, my uncle is this. So I is this.
Guilty.
I is this for life. I is this for life. I ain't never voted for this one. Well, you're wasting your vote if you try fool with independent or that next party. Y'all don't want nothing different. So if come time when it comes to elect these people and y'all continue to do it, you know what that's saying? Well, y'all quite fine with things the way they are. Because if y'all have not seen over, let's say the last 15, 20 years, we ain't even gonna do the whole 40. Last 15 to 20 years, that these are the same. These two parties do the same things, just in different ways. If you ain't see that yet, you don't want to see it. You're blind. So listen.
No, go ahead.
No, go. No, I just was to say that's basically what I had to say. If you haven't seen this as a trend, that they are both basically the same and they're going to do the same things and they're not going to fix these things because it doesn't affect them to that degree and they don't care enough to do anything about it, then listen, y'all telling me y'all quite fine with the system the way it is. You're quite fine with 12 hours in PMH. You're fine with the mold that your patients and your doctors have to sit there and breathe in all day. That's what y'all want because y'all continue to vote for it.
Well, our Prime Minister is a former Minister of Health as well as a gynecologist. Maybe he will spur his current Minister of Health and maybe they'll put their heads together so we can fix the broken system that's been broken from 1970.
Chrissy, let's be honest. The past few ministers of health were doctors. What has that meant?
I'm trying to be positive.
Listen, we got to be real. We got to be real. So them being a doctor and working in PMH don't mean nothing. All them been in PMH, all them is doctors, and they still ain't do nothing. Just because you was a doctor don't mean that you know how to run a whole ministry, a whole organization. That don't mean that you good for leadership. You a doctor.
Well,
now
that's why you have the technocrats who are supposed to fix the problems. And the thing is, if I fix the hospital and I fix healthcare, if no one's sick, how I can make money to drive my C4 compressor?
Well, see that? Exactly. That's what I'm saying. So a lot of people put it wrong.
If I them baby out your front, how I can get paid?
All right, then. All right. That's exactly the problem.
It's a conspiracy.
Conspiracy, that's what it is. I mean, you see it. And I mean, everyone, people deserve to earn whatever they feel they deserve to earn, however much money they want to make. But I honestly don't feel like the medical field is a field to go in to get rich.
Yeah,
you know
right.
What I don't. It should not be, and that's the problem. And that was the U.S. issue with whatever health issues they have. Is the money issue. People go in it to get rich and screw over people because it's so corrupt. It's like, this person have to do this because their life depend on it. Of course, they have to try and spend this money because they don't want to die. You taking advantage of people. Let me tell you, I've been to the doctor, right? When Keisha was still pregnant with Collie. You know them little $2 or $3 pregnancy tests? We going in there. They had
$1 in the Bahamas. They cost like $22.
Man, listen. The first visit, they got to, confirm the pregnancy. So they have to give a pregnancy test or whatever, to make sure. I saw the box. I saw it. It's the same $2 or $3 pregnancy test from the store.
$22.
They must charge me $20 or $30 for this pregnancy test on the bill, Chrissy.
Of course, you pay for one aspirin, you pay must be about $30.
That should be criminal, boy. That is criminal.
Insurance companies want to do that so they could charge the hospitals plenty. You know, so when you have insurance, they just smile at you big.
Yes, because they know, oh, shoot, you got insurance? Well, let me carry this price up a little bit, man. They got it. They're good for it. And then that costs your premium to spike. You got to pay more.
In hospital, when I thought I was losing my baby, I was in doctors for about a week. When I saw that bill, I nearly gave birth right on the spot.
That's what I said. And Nadia say, you funny, Greg. Yes, they want to be rich too. Listen, if you want, my whole thing is, if you want to be rich, it shouldn't be going into the healthcare industry. Healthcare industry. Now, listen, you should be, because I think it's a country in Europe or a couple of countries in Europe where they pay their doctors like adequately, like they make probably 100 and something thousand a year, like a decent salary they could buy their car, they got a nice house, they live in a decent neighborhood, they ain't filthy rich, but they ain't poor, struggling.
Who could afford a sweetheart $100,000 a year? They got to pay their. I mean, I nearly said, Lord.
But my
hold on. Okay, you ready? The light skinned people going. They got to pay their pussy bill. They pussy out in BC. They can't have no sweetheart $100,000.
But that's a problem. Those things should not be driven by money. Like those healthcare, education, these things should not be driven by money. So if you want to be rich, then you shouldn't want to be a doctor. You should not say, you know what? I could be rich. I get into the medical field because, listen, I could hike these prices up. I can make this money. I get in this paper.
But Greg, medical school is expensive as well.
I agree, and I know. But this is why I said, listen, I saying they got to be broke, you know. But I'm saying is, you're running out. You're running out.
It is run out. Well, look in the Bahamas.
$20 for a $3 test?
Oh, yeah. We talk about these doctors. Remember how the nation's second prime minister take all the duty off a dialysis machine for he boy who is the former minister of health. It's all a scam. Mm-hmm. It's all a scam.
It's just too corrupt. And like I said, because it's driven by money, it's so flipping corrupt.
Child, you stay right there. Child.
But we got to do something about it. And like I said, it's up to us people. Listen, we could sit here and we could ramble on. We could sit in our homes. We could have these conversations and talk about all our problems with PMH. But nothing is going to get done if we continue to hand the power over to the very people that have been in power during this time when the system has been the way it is and have done nothing to change it. If you continue to give it to them, then what you expect? You're doing the same thing and expecting a different result? That don't make no sense.
Well, the thing is, it's a bit simplistic, but we all know what systems are flawed. Just like the medical profession has its flaws. The legal profession has its flaws because, again, if I clean it all up, how I can make money? Mm-hmm. It's all about the capitalistic nature of our people.
And maybe that's what Lou was alluding to earlier when she said
my private practice and the government facilities and make more money. Guess what I can do?
Well, I'll be honest with you, Chrissy, and you can tell me how you feel about it. I don't think there should be no damn private practice.
Child, you trying to get paused with all kind of syringe.
I don't think it should be private practice. It's because, like I said, these industries shouldn't be incentivized by money. Education, healthcare should not be incentivized by money. Well, so it shouldn't be private schools where you're making money. You charge these children or the parents out there for these children. It shouldn't be these private practices where you have to go, if you want to be seen in a decent amount of time, you have to dig deep in your pocket and go broke just to get to see the doctor in a decent amount of time. These things should not be incentivized by money. That is wrong. That is wrong.
Greg, what does the Hippocratic Oath say that doctors all swear to? By the way, they Imhotep, not Hippocrates. It says, first, do no harm. That's what doctors are sworn to do. First, do no harm. So they ain't going to do no harm to their bank account, boo. They can make sure they get paid.
Right. And Lisa says...
Don't care about how the people feeling. It's all about, am I going to get this bill paid? Now, you have some doctors, like I remember the late Dr. Earl Farrington. He gave a lot of, as a matter of fact, he did my appendix surgery for free. You have doctors who do give back. I don't want to make them all sound like greedy, capitalistic bastards. You do have doctors who give back. This current Minister of Health has done heart surgeries and has given back. Many doctors give back. However, if we take money out of the equation, it seems like it'll be great and it's altruistic. However, we live in a capitalistic world.
Yeah. But I agree, but I think it should be a balance. In some aspects, capitalism work, but I don't think those things should be on a system of capitalism, education and health, because then you run into these kinds of problems where it becomes about the money.
Wait till we start getting like America when they start making the jail private. I know that coming to the Bahamas.
No, don't speak on that. No.
Nado, Cado, and Vado them will stay getting locked up.
No, I rebuke that in the name of Haitian Jesus. Do not do that.
Do
not do that. Chrissy, where you got?
When you say that, my hand is getting weak. Every time you say that. Greg, I got the bathroom. Greg,
you know just why I say that.
Jesus, you ignorant.
You know just why I say that. Bahamians love up with Jesus, but they hate Haitians, so I just put them together. What y'all gonna do now?
Take it. Okay, I gotta rest my phone down. I can't even.
Michelle said, listen, half of these doctors, $500,000 in debt to get those degrees. What I want to know is, are there any malpractice insurance for doctors here? Because I need to be paid for this botched surgery. I agree, Michelle. I mean, I'm sorry. So sorry you had to go through that. Listen, that is ridiculous. I don't know.
And I know about that situation.
I don't even know what to tell you to do. I have no knowledge on that. I don't even know where to take that. You know what I mean? That is crazy. And like I say, sad that you had to go through that.
I'm trying to get my friend to tell her story about a prominent doctor who just messed her up. But we don't talk about these things because there are reprisals and repercussions when you speak out against the system. But we sorry for what you went through, Michelle, and I know you've been working on that for years. It's so shameful.
Yes, very much so. Bad. Yeah, but anyhow, Chrissy, we done run over time. Let me know. I like talking to you too. Man, listen, I miss you. Listen, this judge need to stop playing so you could come home, man.
The judge, she postponed the case again. She adjourned it again. It's now April 11 or 12.
This is so disgusting that someone has the power to do this to a regular.
Poor justice can do what I tell you. They could come to your house. Like somebody could listen to your podcast, Greg, and be like, you know what? I don't like what that Collie boy say. I'm going to come to his house and I'm going to arrest him. And you got to go.
That is ridiculous.
I'm glad my case being put on the high profile like this because Bahamas going to wake up and see that what happened to me could happen to anybody. So
yes.
That's 10 months now. The more she postponed, the more money we can have. Child Kaylee and Wayne going to Ivy League forever.
But it's just so disturbing that someone has that amount of power to disrupt someone's life off of nothing. Just personal feelings like that.
Greg, again, I'm different. I just high profile. My friend, I told you the story about my friend. Her father was killed by the rich entrepreneur. The boat rolled over her daddy. 4 years later, they still in coroner's court fighting. And this man got money. So what happened to me? But guess what? You soon come here to visit me, child. Once I get dorm.
I take it now. There's do skiing in up where you is?
No, boy.
Oh, okay. See, I think about doing a different vacation this time. I want to go skiing or something, man. Do something I never do before.
Colorado, or let me be bougie. We have to go to Stade. We have to go to Switzerland, darling.
Yeah, man, I would go somewhere to go skiing. But anyhow, let me not keep you for too much longer. I appreciate
what you're doing under the rug. You really are changing the nation's conversation. And keep proud of you.
We're only doing our part. I couldn't do it. I couldn't do it without your help and other people that chip in like Jay and all the other guests that we have helped. We all are working towards this goal of opening the public to different conversation and different perspectives and actually solving things.
We're smart people. Why we can't get it right?
Yeah, and not just beating up our gum over issues. We actually want solutions. You know what I mean? This is why we try to weave in some solutions with every discussion that we have, because we actually want to solve these issues. And so we're going to continue to discuss these things and fight and push to get these things resolved. I mean, I don't know if it'll happen, but we can try to do it. Because health is a human right, is a basic human right.
Right, it's a right. And
Yes.
that's why, PMH really doesn't turn anyone away. It's a public facility, but we have the right to great health care.
Yes.
How inhumane can you be?
Yes. We deserve it.
It's sad, man. But we could I have faith in us, though. I have faith in us.
I hope so. But thank you guys again for tuning in. We appreciate it so much. Please go ahead, if you haven't already, please share the video. Man, I supposed to say that in the beginning. But anyhow, share the video because
$1 on the account.
People can still watch it, so please go ahead and share. And if you want to put $1 on the account, like Chrissy said, or make any donation, you can go to goundertherug.com. Goundertherug.com. There's a donate section. We also have the shows up there. We have the Under the Rug shows, the Entrepreneur shows. I think some of Chrissy old shows on YouTube are still up there. And if you want to follow Chrissy now, you could go ahead and find Chrissy Love Live to the World on YouTube. Subscribe. Hit the bell to get your notifications for when Chrissy come for people and start snatching them and talking about them and exposing them. Yes, you can catch all that good tea on YouTube daily in between 2 and 4 on Chrissy Love Live to the World. So go ahead and subscribe. We also on YouTube. Just look for the Under the Rug podcast on YouTube. Please go ahead and subscribe. Most of the episodes are up on YouTube, most of the videos. But every episode.
84.
Who? This is
85?
86. Eh? This must be 86, right?
Greg.
Yeah, but that's 86.
Some sitcoms.
We almost reach 100, right?
Boy, look here. We got to have a cake when you turn 100.
Yeah, we got to. But we need you to be present, though. You got to be in person when we do that one. So hopefully things get sorted by then. I
got something for him.
Yeah. But go ahead. And like I said, although all the videos may not be on YouTube, but most are there, but all of the episodes are on SoundCloud, soundcloud.com/goundertherug. You can follow us there as well. And you can get straight from episode 1, the very first episode I did with my bald-head cousin, Stevie Burrows. You can catch that one up into this episode, which is episode 86, I think. So please go ahead. Follow us, subscribe, like us on Facebook if you want to catch us live and, get your comments up on the screen like our commenters have been doing all show. If you want that, please go ahead and find the Under the Rug podcast on Facebook. Like the page. Make sure you follow so you can get notified when we go live. And again, please share. We just want to have great discussions and provide solutions so that we can march on to a common loftier goal. Even though we ain't got no common loftier goal right now, we got to set one.
We dead common.
Yeah, we common, but we ain't got a common loftier goal. We gotta set some common loftier goals, Chrissy. Some things that we can all agree on because we too divided right now. That's why we can't get nothing accomplished. Everybody got their own agenda. Nobody got that common loftier goal to work towards. So we gotta work on that, Chrissy. Let's put one together. We can put one together and do a show on it.
Yeah, we gotta put our own common loftier goals up. That's
yes.
a good idea, Gregory. You're so smart and you're so young and smart.
Well, I appreciate that. You see, my hair don't leave me, so I ain't that young, but I trying to stay. I trying to go to the gym. I get to the gym so I could try to stay as young as I could possibly be. I got to stay in shape. You understand? But I trying to stay young for. I trying to get old and all, creaky bones and things.
But you have to go to PMH.
Yeah, well. And on that note, folks, we will wrap the show up. What a perfect way to end. You can always count on Chrissy. Thanks once again. Please share the video. Thanks again, people. We appreciate you. Chrissy, love you. Appreciate you. Thanks a million. Until next time. Peace.